to go to the ER. And the two medical students there argued with me about giving me 10 units an hour of insulin plus 20 units as an immediate bolus. And I knew that at 15 and 125 pounds, that was way too much insulin for me. But because I don't have a medical background and I was just some teenager, they didn't take me seriously. And sure enough, 2 hours later, I was crashing and they were pumping me full of sugar to counteract all the insulin they just gave me.
My father's a diabetic with, bad coronary artery disease, who's gotten care at 3 different hospitals. When the folks at Hospital X don't know what happened at Hospital Y, they're not giving him really good care.
If your records are in Boston and you're in North Carolina or you're in California, there's no way to bring it all together. You get subjected to multiple x-rays that you didn't need multiple of. There are exams that you needed, tests you needed, things you needed to do that actually didn't happen because people didn't realize that hadn't been done.
Not only does that mean that there's waste in terms of money and a burden on the healthcare system generally, it means my mom gets hurt. If I could snap my finger and have one thing transform the quality of care in the country, it would be that everyone would have an electronic health record that would be universally accessible.
And healthcare doctors and nurses, technicians, managers, they want to help patients, but they may find themselves in systems of work that just confound their best efforts.
With medicine, we feel like we have a responsibility and a bond to every patient who we care for. The problem is, with a paper chart sitting in front of you, it doesn't give you information that's up to date. It doesn't help you make connections. It doesn't help remind you of things that is buried in the chart.
The current system means that the information that's required is frozen in glaciers. So you need to go and chip it out of a glacier to find what you need to make good decisions. Our goal with this work is to have the information that's been delivered to your patient liquid, available, there when you need it so that you can make better decisions with your patient for their care.
Our health system has to change. And that it actually has to move toward one that actually coordinates care for a patient, one that actually understands what's going on with a patient or a population of patients.
It's about getting rid of the clipboard that you annoyingly have to fill out every time you go see even your own physician who should know you.
To collect information from multiple parts of the healthcare system, put it in one place that makes it easier for families to manage.
The record follows the patient, so when the provider sees the patient, they can see the total record.
It would put me in a safer situation as a patient. It would give me support and backup when I'm speaking with a physician or a new physician.
You've seen every other sector of the economy use information technology to drive massive improvements, efficiency, quality, service delivery. Healthcare hasn't yet had that opportunity. It's almost a historic convergence right now, and maybe we get the job done if we just really all do that together.
So the opportunity is better care, better health outcomes, better coordination of care, and with luck, reduced costs and improved efficiency.
If you have the ability to do something good now, why wait till later? Why not take advantage of this opportunity?
So you saw it in the video and heard it from some of the medical industry's leading professionals. The timing is now for a convergence between the medical and technology industries. Not only is there an opportunity for better quality of care and the potential to lower medical errors, but there's also an overwhelming need in the U.S. to lower the costs for medical and health care. As a nation, we spend nearly twice as much on health care as we do on our food. Roughly $2.5 trillion we spend on health care and nearly only $1.2 trillion on food. One study by the Harvard Medical School in 2008 showed that administrative automation of medical records may result in saving 5% of the healthcare spending, or $100 billion in the U.S., by reducing adverse healthcare events, such as drug events and medical errors. That's where Singularity steps in. At Singularity, we're a startup company that is going to create an industry-leading portfolio of integrated, secure, open-source system solutions that simplify connectivity for the patient and healthcare practitioner, which we saw from the video is a true need in the medical industry. We're going to provide solutions for not only the healthcare providers, but for the patients themselves. For the patients, we're going to provide empowerment, and for the healthcare providers, we're going to lower their costs and provide ease of use while targeting their EHR solutions. The foundation of our company is Rolf Lorenzen as our chairperson, Jeff Messias as our CEO, Keon Garraway as our CFO, and I'm Taylor Linke, and I'll be the CDO and CMO. Rolf has a wealth of knowledge as he's a graduate of Washington State University in finance and accounting, and he has nearly 17 years of experience between Starbucks and T-Mobile, and his international strategy experience is what we're really going to be calling upon to help us at Singularity. Jeff is a graduate of Arizona State University in supply chain, and he has spent the last 10 years working for Intel as the #1 chip manufacturer and the 6th largest software company. And Jeff is a senior manager at Intel, and his leadership is going to be critical to the startup of Singularity. Keon's entire background is in the financial industry, and he graduated from Brooklyn College in economics and brings 6+ years of experience as a lead financial analyst. And so we're really going to be calling upon Keon to help us with our asset management capabilities, and we really feel that he's going to be able to be a strength there for us. I graduated from Arizona State University with a Bachelor of Science in Business Marketing, and I've spent the last 10 years working for the state of Washington as a regulatory entity, essentially overseeing the licensure and disciplinary actions on healthcare providers. So that's where we're going to tie in sort of the knowledge that I've gained in the outside of the healthcare industry on the periphery, along with Jeff's technological background and Rolf's international experience and Keon's financial experience. But we will need to hire, some other folks in the pending years, and we have those identified here for you. But you may be asking yourself, what exactly is an EHR? Well, an EHR is an electronic health record, which essentially is an evolving concept, but it's been defined as a systematic collection of electronic health information. And it can be anything from data to demographics, medical history, medication, allergy information, immunization status, vaccination histories, lab results, even billing information. And this information is all something that's going to be in a digital format that can be transferred from one device to the next, so from the mobile iPhone or an iPad to a computer, anything like that. So how are we going to help the patients? Well, like I said, we're going to empower those patients. We're going to put their medical records back at their fingertips. And we have different applications that we've been working on, such as Doctor Score, which is going to be the application that allows a patient to put in a search radius, have it pull back all of the different healthcare practitioners that are, in their search requirements, and then that information is going to link to the state regulatory databases to find out those practitioners' licensure and disciplinary histories. So those patients will have the ability to make a better and more informed decision as to which providers they want to see. There'll also be user-friendly applications that provide medical translation services, appointment reminders, things like that. But primarily it's going to help the patient because they're going to have their medical records at their fingertips and can bring those wherever they need to go. For the practitioners, you saw in the video that there's this need for having the information at their fingertips to make more informed decisions as to the best healthcare solutions for the patients. And so that's something that we really think that we can provide by having those entire patient histories all in one electronic format. It'll be user-friendly for the healthcare practitioners. They'll only have to input information in there once. And it'll help hold them more accountable for the different sort of solutions they're providing to patients. And through the efficiencies that are created with time savings, it's also going to help the practitioners to increase their profits. And right now, it's a market that's ready. You heard it in the video. Some other factors that are playing into the market readiness is the fact that the U.S. federal government is putting forth $19 billion in incentives for healthcare providers to obtain EHR solutions, and essentially they're giving them $40,000 to obtain an EHR solution, as well as other incentives. Right now the market's at $15.8 billion, and it's estimated to grow to $31.9 billion by 2015. That's an annual growth rate of 14%. So the market's ready. Not only is the U.S. market ready, but the global market's ready. And as you can see, the growth rates for the Asia Pacific market and the EALA market are rapidly growing as well at 9.7 and 6.7%. We at Singularity, we're going to focus on the U.S. And we have 4 building blocks on which our strategy is based. Again, we have that patient-focused software, the medical practitioner-focused software, as well as medical practitioner selling and patient-focused selling. So far, the industry leaders such as Allscripts are only focusing on the major hospitals and large healthcare practitioner clinics, and we're not going to do that. We're going to focus on the independent healthcare providers and the small to medium-sized clinics. And we really feel that that's where we're going to sort of find our niche and really grab hold of the market. And earlier I had spoken of the ability to save a practitioner time as well as money. And here's just one example. In this automated prescription refill service, the average staff time is estimated for a paper refill to be 15 minutes. The average staff time for an electronic refill is 3 minutes, so that's a savings right there of 12 minutes. And if the number of prescriptions in a clinic in a week is roughly 400, then the total time saved in prescribing in a year is 4,160 hours, which translates into nearly $70,000. And that's just from one potential application that small to medium sized office could, take advantage of. So what we're asking for is $7 million in startup funds. Essentially, we'll have $2.2 million for capital startup. We anticipate 1 year or operational costs in year 1 is nearly $2 million, and research and development costs of $2 million. And by year 3, we have forecasted $11.7 million in profitability, and by year 4, you will recoup your initial $7 million investment. So exactly what do you get for your $7 million investment? Well, you get 40% of our corporation's common stock and 15% in cash returns and 2 seats on our board of directors. The way in which we foresee making our funds is through the selling of the software service to the healthcare practitioners. Now again, they're receiving incentives of $44,000 to be exact, from the federal government for implementing an EHR solution. And we're going to sell them our initial software service at $22,000, which leaves them $22,000 of extra funds that the federal government's going to be giving to them. Now on top of that, we are going to charge the patients a one-time fee of $44, and that's going to allow them to obtain their electronic records and carry them around from system to system. So based upon our estimates, we see that we'll have break-even at 118 units. The average sort of practitioner subscription per month, in case they need additional services, is $50 a month. And again, we anticipate that they'll have an additional $22,000 that they'll be able to utilize from the federal government to cover any sort of software upgrades or anything like that. So from there, where do we go? Well, we anticipate striking while the iron is hot. Like I said, the market is primed and ready to go now. It's definitely a significant growth market where there's lots of different players, none of which really seem to be focusing on the small to medium-sized independent healthcare providers like we are, and none that have the sort of overall knowledge that we do in terms of combining the regulatory aspects of the healthcare industry along with the technology and the financial planning. So we anticipate that we will see significant growth, and it'll diversify into a specialized healthcare software company. And ultimately, we may have to go out with an IPO or a Fortune 500 company, but the future is yet to be seen. So we're just hoping that you see what we see in Singularity, and we hope to hear from you soon. And if you have any further questions, my contact information is listed below. Thanks.